Okay, so I think at this point we can start working through some of our Q&A. So thank you again for joining us. Dennis, is there anything you'd like to add? We've got a question up in queue.
No, I think that I want to thank Larry for a wonderful presentation. And I think as a community, we can see where we have progressed to help support our students and where we still have a lot of work to do. I think one of the exciting things on my side here is that we have decided to do NCHA 2 again this year, right now, at the same time period we did last year, so we can capture what has happened to the student body, how they're feeling, their mental health, physical health after 12 months of COVID environment. So look forward to that data coming in within the next month, and hopefully we can present at the end of the semester what has impacted our students. We're very excited about that. We're going to be going into the field in just a little bit. I guess you can see a lot of different variables here. And as Larry said, we have breakdowns to compare different characteristics on campus, off campus. I think there's a lot of information here for a lot of people to use as we go into the next year, especially now requiring sophomores to be on campus, as well as some of the dynamics that will change here at MSU. Uh, so, are there any questions that we need to address?
So the first question is related to the personal appearance variable. And wondering if there's any context around what defines personal appearance, how it's described, or any other details that might be considered when trying to interpret what that might mean for a student.
The answer is no. I really would like it if there was more context around that, or how that listing in the questionnaire means to various people, but it's not there. So we sort of have to take it at face value.
I thought it was interesting in looking at that particular data point in comparison to 2018, how much it jumped in just those 2 years. I suspect social media has something to do with that, but I just thought that was interesting that that was one that actually jumped quite a bit.
And I will say too, in the NCHA 2 instrument, it's within the mental health section of questions, and the questions worded that it's been traumatic or very difficult to handle. So I think that to handle part, students being able to define what personal appearance is for them is important in that piece to think about. Like in that battery of questions, there's a whole bunch of things related that we saw in the slide related to like family problems and all that. So leaving it broad and not defining it for students, like Larry said, is probably in part what is the purpose of that question to begin with.
Okay, thank you. The next question is related to the actual survey administration I'm gathering. So the question is around campus resources at the outset of the invitation to participate in the survey, specific to campus resources. So if a student responding to the questionnaire needs a resource or is triggered by a question, how are we able to provide campus resources and make those available to students? And I believe, oh, go ahead, Larry.
I think the Karen Clark, who manages the communication with the sample respondents, would probably be the best person to answer. But I believe the note that goes out inviting students to fill out the questionnaire provides them with a couple of contexts. I think usually Dennis's name is listed, and perhaps one other person. If they have any questions about the participation in the survey or about issues that it raises, they can contact those individuals. I think Dennis is one of them, to try to get help.
And that has been the case. We have had over the years students who have either reacted, had questions, had needs, and in some ways, the NCHA has also allowed us to activate help-seeking behaviors. So I've had several over the years, people contacting me, not so much a reactant to the question, although some of these questions we all know could be triggering. It's more about asking about services and actually thanking us for asking their opinions on things. So.
Great, thank you. Okay, and the next question is related to helmet use, something that I know we have long talked about. The question is there a correlation in increased moped use related to the increased helmet usage?
There's no specific question about mopeds, so I don't know the answer to that based on data. And in NCHA 3, they actually are, remember I said that there are some questions added and some questions dropped between NCHA 2 and NCHA 3. The question about rollerblading is being dropped in NCHA 3 in favor of some other question, and the seatbelt use is being dropped. And so we're losing some comparability across time for those things. The helmets, there's no addition of helmet use while using mopeds that would differentiate a moped from a motorcycle kind of thing. So that's the closest there is. So, and I don't think that would be a good comparison.
Okay, thank you. So we've got a couple more coming in. The next question is around the recent legal change in Michigan around online gambling. Have we considered adding a question around online gambling?
I do not believe that NCHA has made any moves in that direction. It's not in NCHA 3. Periodically, when something becomes a new fad, fashion, or high-level activity, as was the case with e-cigarettes or using a hookah to smoke tobacco, they've added questions to a version of the questionnaire that can then be used, but I don't think it's in there now, and I don't anticipate that it would be in there going forward. It's probably a Michigan-specific phenomenon right now, new to Michigan, not new to all states. And so we'll see what happens going forward. We would always have the option, if it was a big enough issue, to pay to have an additional question along that lines added to the questionnaire. As we've done in other years, we've added supplemental blocks of questions. There were some added in 2020, but for time reasons, we chose not to review the results of those in this presentation.
We have probably some of the best IPF people who clean our streets, but they seem to want to clean my street right outside my office when I want to speak. So please bear with me. We are concerned about this, and I think anyone who watches any TV at this point knows the number of commercials about online gambling and what has happened in Michigan. And I think in the future, we will be asking questions about that and trying to respond. I do remember, Larry, in the beginning when we first asked a question about whether internet or computer use was affecting your academics, and it was really high. We were very concerned whether some of that internet use was computer or internet gambling. So it is something we'll keep an eye on. I will say that with NCHA 2 that we are going into the field in about a week, we have added 2 batteries of questions, one on vaping, because vaping has been both a concern for many reasons, but also the concern of sharing vaping equipment during a COVID environment. The other battery of questions we put in there is perceptions about vaccine use. When the vaccine is available for students in a couple of months here, we want to know why a student would vaccinate and why they would not, and who they trust and things like that. So those are the 2 batteries we are adding to NCHA 2. But you know, as you go through this presentation and you think about all the wonderful people on campus who are trying to help students, we could add probably another 400 questions to the survey, but it is long as it is now. So.
Okay, you might have answered this a little bit in part already. So there is a question around which particular factors we're interested in monitoring over the next year. Anything else anyone would like to add to that answer besides the vaping and vaccine questions?
I'll throw a suggestion in, since I'm not going to be doing much of this. I can make all the suggestions I want. Nobody has to follow them. I think especially since we're going to redo, administer the NCHA 2 instrument within the next month. The things that need to be looked at in particular, I think, have to do with the levels of stress, anxiety, depression, loneliness, all those negative emotions, and whether those have been intensified or more prevalent as a consequence of all the things that people are going through, whether it's remote learning or not being able to spend time with friends and family, or just get out and do things for fun, whether it's exercise or go to movies or concerts or athletic events or whatever it is. I think there are a lot of things that are likely to affect stress. And so being able to look at that and then the relationship between that and academic work, I think is going to be important to take a look at. That was one of the reasons why we thought using NCHA 2 rather than NCHA 3 for the follow-up would be best, because we have such longitudinal data with which to compare what they would find. So it'd be really informative, I think. So that would be my suggestion. So I obviously using NCHA 2 will also be able to look and see whether there are changes in drug use. If people are trying to medicate themselves to deal with loneliness or stress or boredom or whatever it is, then those would be important things to take a look at as well.
We are definitely going to keep a watch on both food insecurity and housing insecurity, as this pandemic not has only affected the parents of students, but students themselves. We have seen a significant uptick in the number of students who are using the MSU Student Food Bank. And as someone who's been involved with this for since the beginning, we are trying to meet that need. And I think the university is very concerned about that, and housing insecurity. I think we also need to look at how the current environment or the past environment has affected students seeking help. You know, whether it's different racial groups, LGBTQ folks, and on and off campus folks. So there's a lot of things that we need to be observant about. If you truly think, like I do, that health is about the capacity that you have at any given moment, the capacity of students to be successful needs to always be taken apart and looked at. What is that's affecting their capacity? How we exist here and why we exist in health promotion is to remove barriers to academic and social success. And so all aspects of that. I said the other day that maybe we should not focus on counting calories or counting steps or counting vegetables, but spend more time counting our blessings, because we do need to have a positive outlook as we go forward. So please let us know those topics you think you want us to kind of follow, and we'll try to include them. Thank you.
And there are a couple other suggestions in terms of things to consider including next time. So we will make a note of those, and we can download the Q&A report. So we'll have a file of that. So there's a couple of questions that I think I'm going to try to loop together, and it's specifically around demographic categories. And I know as a staff, we've spent some time talking about what the actual questionnaire asks and how we are able to report it out. So the question really is kind of about expanding those demographic variables beyond male versus female, white versus other, white domestic and other domestic. Is there anything you can add around how those categories are actually reflected in the survey and ways we might be able to look at that going forward?
There's a difference between what the question can look like and what you can do analytically. So given the distribution of various kinds of people on campus, even if you allow for all the various kinds of ways people might identify whatever category they belong to, when the numbers get relatively small, they get too small to do any meaningful analysis for. So to in any way efficiently and powerfully analyze data, you have to have numbers of cases of sufficient size for the results to be worth paying attention to. So the way the questions asked can be changed, but oftentimes you then still have to regroup or collapse categories into some other category in order to make it analyzable and summarize in a meaningful way. In many of the analyses, when we try to do things by race or ethnicity, the numbers of Native Americans is almost nil. Now, there may be a substantial number on campus, but when you take a sample of 1,000 from the population of 50,000, then that 1% or 2% in the whole population turns out to be only 1 or 2 individuals in a sample of 1,000. And the same thing happens with even larger groups like African Americans or Hispanics or something. Even if they make up 6 or 7% of the student body in a sample of 1,000, that ends up being a pretty small number in terms of the margin of sampling error on any estimates that come from that group. So in order to be able to do any sort of meaningful analysis, you're sort of put in the position of losing the uniqueness of one group versus another in order to have a large enough group to be able to do anything meaningful with whatever results you have for that group. And so there is a difference between what you can do in terms of identifying all the various possible categories of people and how they might want to be referred, and what you have to do in order to make a meaningful summary of results. So it's a not very helpful answer, but it's my answer.
And like Erica said, this has been a conversation that we've been having since the summer related to how we can report some information that is more specific demographic categories of students so that we can get a better sense of what our various students of color or students of different genders, how they're experiencing MSU and the different health behaviors that we have data on from NCHA. So that being said, it's still in process, and we understand that a lot of campus partners are interested in that information. So if you are interested and want to sit down and we can look through what we have, we may not be or have the big analysis of it all, but to just look through the responses that we have related to specific demographic groups, I'm happy to do that. And I'll put my email in the chat for people to reference as well. So feel free to reach out to me with that, or if you'd like that information or to know more about certain topics or students.
One of the options that we've discussed when we want to do a more detailed analysis about smaller subgroups of the population, I know there's been interest in trying to compare Greek students to non-Greek students on some things. And as I showed you in the slide, that on this survey, 8% of the students said that they were members of a Greek organization. And so 8% of the 846 students in the sample is not very many. So the analysis that you can do is not very robust, but one option is to combine the surveys from different years. And so that you can combine the numbers of that group from one year with the numbers of that group from the subsequent years, and you end up with a larger sample of members of that group. And it may make for a more robust analysis. The downside is that you then sort of lose the trend lines because you're combining years rather than being able to see what was happening from one year to the next.
Thank you. So we've got just, I think, 2 more questions and we'll wrap this up. So a question around the tobacco-free campus, and are we still including questions related to that? Any insight on that?
We did include 4 questions related to the tobacco-free campus in the NCHA, maybe both 2 and 3, but at least in NCHA 2 in 2020. And I actually had slides built to review that results, but we just we chose not to show them because of the time constraints. But I can tell you that overall the results for the 4 questions were very, very similar to what they were in 2018. And those of you who are familiar with those, the report from that know that what we had seen was a drop in the exposure to secondhand smoke from before the implementation of the ban to after the implementation. We'd seen a drop in the percentage of people who reported encountering the waste from tobacco products from before the ban to after the ban. And the support for the ban had continued to be about 95 or 96% in favor. So the results were very much like what they were in 2018. And if anything, they were modestly better, but within the margins of sampling error. So there's still strong support for maintaining the ban. But that information is available in the full report.
Okay, and then lastly, there was a note that the food bank use is up overall, and do we know if the percentage of international students using the food bank is up or down?
The overall number of asks for help for food insecurity among international students is up, but we've seen a greater percentage of domestic students who are now coming in for the food security project. And since I have the soapbox for 10 seconds here, let me just say one of the greatest challenges is removing the stigma of using the food bank. If I had my druthers, I wouldn't even call it a food bank. I'd call it a food security project, very much like financial aid. We need to remove the stigma for students, especially nowadays. I've been called from the counseling center and other places saying that they have a student here who hasn't eaten in 2 or 3 days, but they don't feel either worthy of using a food bank or I don't know how to. So we need your help to get the word out that food security is no different than financial security or the financial aid office. If you need food, we have food, and we will supply that to you. So overall, we've seen an uptick. International students, by proportion, a greater uptick in domestic students, but overall, international students is up too.
As I would add, since we didn't mention it otherwise, there was a whole new battery of questions added to NCHA 3 that is designed to measure food security, insecurity. And the data from the NCHA 3 has actually been analyzed, and a table showing both how it's put together and what the percentage breakdowns are among the campus population are included in, I think, in the appendix or the last section of material in that full report that Andrew had shown you the link for. So if people are really interested in seeing what the results were for 2020 on the food security insecurity issue, it's available to them immediately in that report.
Perfect. Thank you all so much. So that concludes all of the Q&A we've received so far.
Yes, I'd like to thank you all for sharing your time with us. I know time is a valuable commodity, and we appreciate you taking the Friday morning to be with us. I want to thank all the experts and people smarter than I who have lent to this project. I want to thank Erica for putting the actual webinar together with Andrew's help and Jordan. We have so many people to thank. We thank ACHA for supporting us as we have moved through these 20 years of using NCHA. They've been a great partner, along with MSU and also the Anheuser-Busch Foundation, which has helped fund the National Social Norm Center. We're here to help you. We want to help you. I think you can see that even though Dr. Hembroff will be partially leaving us, we are fully operational and ready for the future with Ms. Jordan Salerno and the rest of the staff. Health promotion is about promoting capacity. Student health and wellness services is about helping students remove barriers to academic success. That's the bottom line. We want them to be socially and academically successful. And we also want to thank our partners from the city of East Lansing, who's been so supportive of the work we do, and we work hand in hand, and we appreciate them very much. Dr. Hembreth, you know I can't say enough about you, but even though you may be finishing your working relationship with a friendship goes forever. And we thank you and I can't live without thanking Miss Karen Clark. Miss Karen Clark, who is the wizard of instruments of Office of Survey Research. We couldn't do a lot of things we do without Karen and our colleagues over in HealthCom in the College of Communication Arts. Thank you all. If you have any questions, a lot of these are very valid questions. Jordan's able to handle this. Larry's able to handle the rest of us. So we wish you well, be safe, and look forward to NCHA 2 that we'll be doing in the next week and a half. And hopefully we can have the results so you can see at the end of the semester. Thank you all. Take care.